Non-surgical periodontal therapy. So I'm going to talk about this topic today because it's such an important treatment to know what you're doing for patients who have periodontal disease, either mild, moderate to severe. So what is the latest evidence-based update? So non-surgical periodontal therapy, or what is known as NSPT, the latest evidence, we want to know what it actually works and where the things are still under investigation. So scaling and replaning, or SRP, has long been considered the gold standard for NSPT. So there's a good amount of systematic reviews. They consistently show that SRP is highly effective in reducing probing depth, improves your pleating and probing, and also improve your clinical attachment levels, in particular in pockets that are deeper than 4 millimeters. Now, you're gonna ask me, so what are the best instrumentation to achieve really good non-surgical treatment? What are the best instrumentation to use? So basically we have the ultrasonics or your hand instrumentation. I think both are effective, and often, say for example, your ultrasonics will have advantage over your hand instruments for better access to furcation areas, faster debridement, especially if patients, they have a lot of local factor, a lot of calculus, supra and subgingival calculus. My advice, or what I personally use, I use both. I have to have my ultrasonic with different tips, and I have to have a good selection of my manual instruments. So basically, you know, your scaler, your curettes, your universal curettes, your Gracie curettes, depending on the area. So for example, as I said, the ultrasonics are faster. Possibly it's much more easier to go through the furcation area, especially the distal furcations. However, you really not like this kind of, you want this smooth, good finish of your roots, so it can facilitate the new tissue attachment onto the root surface. You need to get your manual instruments right there. So it really depends on your choice, making the right choices, your case selection, and your tooth selection as well with the instruments you're using. Do you think we're done yet? Absolutely not. Follow me for part 2 about non-surgical therapy to know more what you need to do with your patients who suffer from periodontal disease.